Hi. Think about the last time you saw your doctor. Maybe you saw your doctor because you're sick. Or maybe you were feeling well, but you went in for your regular yearly checkup. Either way, you saw your doctor in their office, which means you drove there. Or maybe you took public transportation. But either way, you sat down across from your doctor. You had a conversation. Maybe they said, I'll run some tests, and I'll call you in a couple days to let you know. Now, imagine you live a day's drive from a doctor, and you don't have a car. Imagine you have kids at home, and you're the only one taking care of them. You can't just leave them alone. So if you're sick, you're probably going to make it into the doctor. But what about for your regular yearly checkups? Maybe, maybe not. In this way, just having to travel to get to a doctor's office or a clinic or a hospital can put people at a disadvantage, especially those who live in remote or rural areas. Now this summer, I had the pleasure of traveling to Botswana. Botswana is a beautiful country in southern Africa. It has pristine natural landscapes, amazing wildlife. Botswana is a small country of about 2 million people, and I was an intern in the capital city. I was working in a research lab learning about healthcare. I spoke with a doctor, and the doctor showed me piles and piles of samples, patient samples, waiting to be screened for cervical cancer. Each one of these samples represented a person who overcame barriers of transportation, time, and energy costs to get into the clinic to get screened for cervical cancer. Now, the doctor told me sometimes there aren't enough cars to transport the samples from the hospital to the lab and back. And this and other infrastructure issues meant that each person might have to wait over a month to hear their results back. Each of these scenarios I've talked about takes place in our current healthcare system, which is a centralized healthcare system. Centralized healthcare is when we go to central hubs like doctors' offices, hospitals, clinics to receive care. Think about how this can really disadvantage the world's most marginalized. Those who live in low and middle income countries, those who live in remote or rural areas. What if it doesn't have to be this way? What if we could receive healthcare without leaving our homes, without seeing a doctor? Okay, does that sound unrealistic? Well, who's heard of the take-home pregnancy test? Almost everybody, right? Even if you've never used one, you know what it does. You pee on a stick. It tells you if you're pregnant. What if we had something that was as easy to use, as widely accessible as a pregnancy test, but for other things, like a full panel of STIs, or even cancer? Now think back to the samples in the lab in Botswana. They were waiting to be screened for cervical cancer. Now, cervical cancer is a cancer that develops in the lower part of the uterus, or the cervix. And unlike almost all other cancers, we know what causes cervical cancer. Cervical cancer is caused by a virus, human papillomavirus, or HPV. HPV is a sexually transmitted virus, and it's the most common sexually transmitted virus. As a matter of fact, almost everyone who's sexually active will get HPV at one point in their lives. But don't panic. Almost all HPV infections are completely harmless, and it's probably going to go away before you even know you have it. But there's a small subset of HPV infections that are dangerous and can cause cervical cancer. And if we can identify this small subset of dangerous infections and treat them, we can actually prevent cervical cancer. So I just told you that cervical cancer is preventable. But I'm also going to tell you that out of all the cancers, cervical cancer kills the third most women worldwide. Why? Why is a preventable cancer killing so many people? Well, in the US, a cervical cancer screening program was implemented 30 years ago. And since then, cervical cancer deaths have dropped by over half. So screening for cervical cancer properly can prevent deaths. Now, 85% of cervical cancer deaths occur in low and middle income countries, which suggests that it's a lack of resources that's killing so many people. What can we do? how can we better allocate our healthcare resources and make them more widely accessible to everyone worldwide? I believe that we can do this by decentralizing healthcare. Remember I said that centralized healthcare was going into hubs like doctors' offices and hospitals to receive care. Well, decentralized healthcare is integrated into our daily lives. It can be anywhere and everywhere. One example is the pregnancy test I talked about earlier. Another example could be at-home health monitoring or mobile health clinics where clinicians drive to people's homes and treat them there. Or an empowered group of people, community health workers, that live and work in their community. Another example is using cell phones. Almost everybody in the world has a cell phone. I got to see a good example of this in Botswana this summer. Now, the summer I was in Botswana, there was an outbreak of diarrhea. And diarrhea can be really dangerous, especially to young kids. I learned about this outbreak by a text on my cell phone, which, let's be honest, is glued to my hands. So this text told me everything I needed to know. There's an outbreak. Here's who's most susceptible. Here's what to do if you get it. Most importantly, wash your hands and boil your water. This is healthcare. This is decentralized healthcare. This information wasn't only available if you could make it into the hospital or if you lived in the capital city. This information was disseminated to everyone who had a cell phone. I'm a bioengineering student, and I want to use what I've learned to make healthcare more accessible worldwide. One idea I have is a self-test, like the pregnancy test, but for HPV, that virus that causes cervical cancer. I imagine you can pick this test up at your local store or corner market, take it to the privacy of your own home, and get your results immediately. I had this idea as an intern in Massachusetts General Hospital, talking to my mentor, Dr. Cesar Castro. Dr. Castro shared with me his big vision for decentralizing healthcare, and he really inspired me to continue working on this throughout my career. And this fall, I'll be enrolling as a PhD candidate to do just that. I want us all to think about how we can better allocate the resources we have and make healthcare more widely available and more accessible to everyone. I want us all to think about how flipping healthcare on its head and decentralizing medicine can lead to a healthier world. Thank you.